presentation, and let's get started. All right, Drew, let's go to the next slide. So welcome to our Meet the Team. I'm Jessica, I'm our host for the evening. We've got lots of great things to speak about today. We are going to be talking about preparing for birth, what to pack in your bag for either hospital, birth center, or home birth, as well as preparing for your best fourth trimester experience possible. And at some point, we'll be welcoming in our chiropractor, Dr. Sylvia, to talk about the benefits of chiropractic care for pregnancy and postpartum. So in these sessions, they're really great because we get to learn lots about what it is that we do. We love to share education and tidbits with the community, but it's also a really great time for our clients and people that are interested in just about what we do to learn more about who we are as a team and ask really any question under the sun. So let's get started. So our first guest speaker of the evening is Heidi. She's a postpartum doula and lots of cool things about her. She's definitely a baby whisperer. She brings her calmness into rooms when things might be a bit hectic, might not be all rainbows, but Heidi has that calmness about her to help really put anyone into a good mood. And she really believes that every family has their own best way to love and nurture their children. There's plenty of ways to parent. So Heidi's going to be speaking today about preparing for labor, and I'll let you take it from here, Heidi.
Thanks, Jessica. Good evening, everybody. I hope that you can hear me. Good. I'm going to talk a little bit about preparing for birth, but there are so many different ways that we can do that. So what I'm going to focus in on is really just in this short presentation, just to talk about some of the real specific things that you can bring along with you. And I thought a neat way to do that would be to talk about what do doulas bring to a birth? What's in my doula bag? And then all of you can kind of think about what might be a good thing for you to bring to your place of birth. So the items in my bag tend to fall into three categories. The first is, what can you do to make the environment in which you give birth comfortable and safe? We know that it's so important for moms to feel safe and relaxed, and then that often leads to good birth outcomes. The second category would be energy and hydration. You know, it's a physical event, birth. It goes on for quite a long time and you need to be drinking. The partner and the support people need to keep their energy up too. And the third category is relaxation. What can you do to bring yourself to a really peaceful, calm place? Because that's when birth happens best. So I'm going to go into my bag. The one thing that didn't fit in my bag were the first thing on every list that I tell parents to bring to their birthplace is pillows. Bring lots of pillows because you get one little pancake pillow at the hospital and it's not enough. You know, pillows are one of the best things for comfort and relaxation, you know, putting them over chairs and underneath legs. And so you need a couple of these. Bring your pillows. The second thing, I'm just going to reach into my bag and see what I find. Well, it's something big, a water bottle. Really important to stay hydrated for mom, for partner, bringing whatever flavored waters or energy drinks. So important for mom to stay hydrated. One of the important reasons is that mom goes to the bathroom a lot because sitting on the toilet and going pee is so helpful for helping to open things up for birth. So bring drinks. Snacks, healthy, nutritious, high energy kind of snacks, granola bars, fruit, protein foods, nuts, whatever you can eat that isn't too heavy, but gives you energy. Really important for that long haul of birth. What else is in my bag here? Next thing that comes out is socks. Or slippers. Keep mom's feet warm. This is falls into that relax or that comfort category, you know, making you feel comfortable with your own things. What else do we have here? A deck of cards. Distraction is a good way to get through labor. So doing things that, you know, just pass the time and not let you think so much about what's happening. Crossword puzzles, Sudoku, games on your phone, Scrabble, whatever your favorites are. This is a little electronic candle. So this would fall under the category of making the birth environment cozy and relaxing. You know, they have beautiful pillar candles. You know, if that's important to you, that's something that you can do in the hospital setting. Also, some people like a certain fragrance. And so there are ways to have a lotion or something that you can smell that makes you go to that peaceful, relaxing place. A comb. Moms sometimes like to have their hair combed during birth. Another way to use a comb is actually to hold it. It's like a little bit of a distraction. If you hold on to a comb during a difficult contraction, it can actually give you a little counter stimulation. So there's different things you can do with a comb. Tea or coffee. Those are things that, particularly for the partner, you know, think about having drinks for yourself, things that you might want to have that you can just pull into your bag and grab your favorite, you know, instant coffee or tea. Massage oil, great to relax mom with a hand or foot massage or rubbing her back. So sometimes it helps to have an oil of some sort to just make the glide a little bit easier. What else? Along the massage lines, I have 2 tennis balls and a sock in my bag. So this is a great, really easy massage tool to rub up and down mom's back. But maybe you have a massager, or maybe you have a little knuckle massager, whatever works for you. I always have earplugs in my bag because hospitals are not quiet places. There are beeps and PA systems and noises, people coming in and out of the room. And so for a lot of moms to be able to get into the zone and go to their peaceful place, it's nice to just pop some earplugs in. Especially, you know, if you're on a monitor and you don't want to be hearing all those beeps of what the monitor says. It's nice to put something in to relax you. And along those same lines, a mask to just be able to block off light. It's very hard to make a hospital room completely dim. So an eye mask is a nice way to be able to go into your zone and go inward. What else do I have in here? Mints. This is a good one for dads and partners to be having something to suck on for energy, but also have breath. So have some gum and mints because you're going to be sticking your face right in your partner's face, and it's nice to have good breath when you're doing that. What else do I have in here? Oh, lip balm. That's a wonderful thing to have. Moms, because they're doing so much breathing, are getting dry lips often. So some soothing lip balm can be a really lovely thing. And it's nice to have your own for that. And then the other thing that I found in my bag is a hot and cold pack. You can make them. Mine is a rice pack. It can go in the freezer, you know, to just put on mom's forehead, or it can go in a microwave and get warmed up. They come in different sizes, but these can be a really lovely tool for comfort. So this is not an exhaustive list, but I hope it's given you some ideas for some of the things that you might want to pop in your bag or before going to the hospital. And what I really want to say is that in a doula's bag, the best things are the invisible things. So they're her experience, her knowledge. She's been here before, and she knows when is a good time to hop in the shower or the tub. She knows when it's a good time to put her hands on you and wear. So using visualization and breathing techniques and all those things that we can't, you know, we can't show them to you, but they're super, super important for the birth experience. So I'm going to conclude with saying that I just wish all of you a wonderful journey in your birth or parenting experiences, and I look forward to meeting you later. So I'll sign off. Thank you for listening.
Thank you very much, Heidi. Those were lots of nice tidbits. What made me kind of giggle the most was the comment on the mints. I cannot tell you the number of times I've supported families and, you know, the partners had a coffee because it's long, and then all of a sudden it's go time. And they're like, do I have time to go brush my teeth or, you know, whatever? And we're like, well, no, baby's coming. And it's always nice to have mints or gum or something. So it's the little tiny things that can really make that experience. So thank you for your humor, as well as lots of your education today, Heidi. So before we jump into our next guest speaker, Amanda, I do want to share with all of you, I'm not sure if I said this at the beginning, but we do have breakout rooms at the end where you're going to be able to get to know more of our human side. So if you registered late and you'd like for us to know a little bit about you, feel free to send a message in our chat to everybody with who you are, where you are in your pregnancy, and what you're most excited for so we can get to know you. So next we have Amanda Kennedy, who's a postpartum doula here at Helping Hands, and she's going to be chatting about preparing for birth, preparing for fourth trimester, pardon me. And she has three, I love this part, not so little daughters. I'm sure they're always your babies though. She loves being outside, taking yoga classes and exploring new places. And she also loves curling up with a good book and a hot cup of coffee. Love that. So Amanda, take it away. Tell us what the heck is the fourth trimester and how to prepare for it.
Like the big eyes, right? The fourth trimester. Well, I was actually having a conversation with a client yesterday, and we were talking about the fourth trimester, which is technically your first 3 months after birth. So you have your 3 trimesters of pregnancy, and then we consider the first 3 months after baby is born as your fourth trimester. And we were discussing how it's kind of similar to a marriage. You spend all this time preparing for your wedding, like you prepare for your birth, which are all really important things to do. But then sometimes we forget there's a long time afterwards that we need to think about. So she was really excited that we were talking about the fourth trimester. And it's my favorite part of what I do, which is being a postpartum doula and working with those little itty bitties. And there's a lot of things that can come up in those first 3 months that are good to start thinking about and being as prepared as you can. So the first thing that comes up, and you've probably thought about, is feeding. And there is a lot of things around feeding. You have a choice on breastfeeding, formula feeding, mixed feedings, where a lot of people can do at the very beginning, may want to supplement breastfeeding with formula to get their little ones back up to birth weight. You may continue that way. You may choose to do exclusively pumping. There are a lot of options, and spending some time getting to know those options. If you're going to be using bottles in any way, what's the best way to be doing that? So we teach you how to do paste bottle feeding. You can learn all different kinds of things through our infant feeding class, and there's tons of information available online. It's really important to know some of the obstacles that you can run into with breastfeeding or formula feeding, and just being prepared for the things that could happen so that it's not so scary when it probably something will happen, and you have the information and you can choose what to do with confidence and trust your gut with what you want to do. And then knowing that if you have a doula support or someone, another friend who's possibly recently had a little one, that you have people that you're confident in talking to about your choices. If you are going to try breastfeeding, it's a really great idea to start a conversation with a lactation consultant before you've even given birth, scheduling appointments with them for right afterwards. even when it goes really well, it can still be very challenging. So it's really supportive to have someone on hand that knows what's going well and can help guide you to make it even better and help you be confident in what you're doing. Next would be newborns and the expectations around newborns. Quite often when we're out in public, we see babies who are out of the 4th trimester. So our expectations about bringing our newborn home are sometimes surrounding what we've seen out or seen in movies, and it's not realistic because most people aren't doing much other than being home with their babies in those first few weeks. So we offer a great infant care class. There's lots of information on sleep, what that looks like for a newborn, what awake time looks like for a newborn in the 4th trimester, which little bit of give you a little tip, there isn't much awake time. And when they are awake, it looks like they've gone from sleeping to eating and then pooping and right back to sleeping again. So it's not much of an awake time. That will change over the first 3 months, but it's always funny when you start talking about like, when are we going to have that first bath and when are we going to have baths? Because they're never awake. So trying to fit that in and then how that changes as the days and weeks progress and they start to have more awake time. But at the beginning, there really isn't much. Next thing to start thinking about is your supports. So who's going to be there to support you? Do you want to have a doula, someone, or do you want them during the daytime? Do you want them at night? A combination. Food. That's a really, really important one. Are you going to have something planned ahead of time? I've seen some really neat things. A client who has basically a food doula, who is someone there cooking for them for the first 3 months, which is, I'm like, could you come to my house? Or having services that provide food, or family members who drop food off or cook stuff and have it ready in your freezer for you. But it is really important, and it can be very challenging to find time to eat when you're dealing with a little one and then trying to get some rest yourself. Cleaning should be for anybody but you. It's really not a priority. Obviously, you want a clean environment for your baby, but the dishes, laundry, all of those things, we can help with that. And when people say, hey, I can help, what would you like me to do? Hand them a broom. Say, yeah, sure, you can help. Here is something you can do for me. They don't need to be sitting and holding the baby so that you can do it. You can actually sit and cuddle your baby and they can do it. Take some time to think about the people you anticipate visiting you over those first few weeks. So who do you think your friends will be that may drop by, family that want to come visit, anyone who may be staying with you, and what that might look like. And be sure you're not overloading yourself. So it is okay to say, you know what, I need to rest right now. Could we do this tomorrow? Or can you come a little later in the day? Or, evenings aren't going well. Maybe you could pop by for a coffee in the morning for a few minutes to see us. Be gentle on yourself and be fair to yourself. You don't need to do what everyone else wants. You need to do what's right for you and your baby during that time. Sometimes that can be really challenging to communicate, and we're happy to help you communicate that with people, especially if they're there and you need to go rest. We can happily sit and chat with them and move them along so that you can go have your time. But it is really important to think about that and what you think you will be able to handle, and then being able to work with your partner to make it easier if something happens that you weren't prepared for. The next slide, I think, is probably the one that I think is the most important, which is assessing your expectations. I think it's a really great idea before your little one arrives to sit down and have a conversation with other new parents. Ask them what they've experienced, what kinds of things they wish they had known, but also having a conversation with your partner about this is what I expect you to be doing, and this is what I expect I'm going to be doing. And does that match? Do you both actually feel that way? And making sure that you understand where you're both at before the baby arrives. And then when the baby does arrive, you have to revisit that conversation. And you know, mine are a lot older. You have to keep revisiting the conversations, and it changes and it looks differently. But the more you communicate, it sounds a little cliche, but it is really important. Also getting to know what's really important to each of you so that you're supportive of each other through that and can help make it happen, and not downplay something that you may not think is that important, but the other person truly does believe is important. So next is getting some important things ready. So there are items for all members of the family that you'll need. So for the baby, obviously you probably have a very exhaustive list right now. It's diapers and wipes and clothing and change tables and all of those things. And that's pretty straightforward. For the birth parent, that's also pretty straightforward. You know, you're going to get a bag ready for your birthing place, being prepared for recovery afterwards, all the things you may need. But it is also important to consider if there's siblings, something to help them understand what it's going to be like if this is their first sibling, what babies are like, that they're not like a new toy for them right away, that they might not actually be that interesting. And also knowing that they're still going to have lots of love and attention from their parents. And for support parents, you can start thinking about things like, do you want to be supporting baby by using carriers and doing some baby wearing? It's something, if you have a hard time staying awake in the night, it will be harder for the support parent to stay alert, something to help them think about that. And planning for ways that you want to get through the nights and days, but especially nights. Who's going to be doing what? Is the birth parent going to be doing the feeding, and then the support parent taking care of the rest so that they can go to sleep? Or is the support parent resting to go to work the next day? What does that look like? And planning so that it can be successful. Another great idea is using this time for reading. Think about things that matter to you in raising a child and a human, a person, and focusing on those things and how to advocate for yourself and be confident in what you want to do. We do have a great blog on our website with some different books that we've kind of done little recommendations on, and there's some really good ones on there to take a look at. Okay, for the recovery period, so this is important to consider for both a vaginal and C-section delivery. A C-section delivery, of course, is a major surgery, and you need to follow the doctor's orders, and you know, and there's a significant recovery process there. But it's also important for a vaginal delivery. There can be a lot of different things that happen that you need to have the time to recover from. And you know, you obviously have a brand new little human to care for, but part of caring for them is caring for yourself. So don't rush yourself, take your time, make sure that you've healed properly so that you can care for your child. Also take some time to know the difference between the baby blues, which is very common, and postpartum depression. They look similar, but they have some pretty hallmark differences between the two. It's also important to know that birth parents and supporting parents can both experience postpartum mood disorders. So this is not just for the birth parents. Supporting parents can experience it too. So be aware of what the symptoms are and just be alert for it. So if you start to notice anything, you can have conversations around it and be on top of it. Also think about where you're going to want to recover. So if you want to be spending most of your day downstairs in a main living area, setting up a station in that area that has all the diapering needs and baby needs, some water, snacks, all great tools for just being able to stay in one place and relax and rest and recover. And then also if you have multiple floors in your home, having a different station set up in different places so that you're not running around looking for a diaper when you've had a blowout. Being prepared. And that is a great thing for supporting parents to also be doing, is checking those stations and making sure that they're stocked up and ready to go. It's also great to have a space that's near a bathroom and a place that you can rest easily. And I think the last slide I have, which I think is a great reminder, is to be flexible. You need to do what is right for your family, and every family has very different needs. And every baby is definitely unique. And if there is something that is very important to you, I can guarantee your baby will find a way to make it challenging for that to happen. But ultimately, the only people who truly need to be okay with your decisions is the ones that are with you in the middle of the night. So you and your partner, obviously outside of keeping your baby healthy and any medical needs they may have. The rest of the decisions are ultimately yours, and there's no one else that you need to make happy. As long as you're happy, baby will be happy, and you will be well on your way to being done the 4th trimester and enjoying your little one. Thank you.
Thank you, Amanda. I was trying to find my unmute button. Thank you very much for sharing so much about all the things that I find most first-time parents don't think about at all when, getting ready for their baby. I think all of us can resonate with hearing, the fun things on the registry, but all the other things can kind of come, after the fact, and they really are the most important. So next, but definitely not least, and this is our last presenter for the evening, is Dr. Sylvia, our chiropractor extraordinaire from Create Wellness. And she's going to be sharing lots of wisdom with the benefits of preparing for your birth, preparing for postpartum, with helping your body get ready for this really cool experience with welcoming a baby. So her practice is located in Toronto, and she's been doing this for a hot minute. She's doing this for 20 years already. And she has a real passion with providing her patients a healthier lifestyle and enjoyment. Now, she does several techniques, one of them being the Webster technique, which is really important when you're looking for a chiropractor in your pregnancy. And I will let her take it from here. Go ahead, Sylvia. Thanks for joining us tonight. Oh, Sylvia, I think you had the same problem as me. You're muted.
Got you. Hi, everybody. Thank you, everybody at Helping Hands, for inviting me tonight. And big congratulations to everybody here. Your pregnancy is probably one of the most important times of your life. So congratulations, and you're going to be wonderful parents. I'm also going to say congratulations for actually making the right decision and having, these group of wonderful women, these doulas that are going to support you. I've also had the experience of having a doula almost 15 years ago. And I can honestly say from experience, we never thought that it was going to be one of the best decisions that we've ever made. But she not only helped me, but she actually helped my husband also. So she was there with him when he almost fainted. So she was there with him when he thought that he was going to be the first one to actually touch my daughter and catch her, but took a little nudging from Toby, our doula, to get him there and to support him also. So you know what? You are going to love having your doulas with you. So why see a family chiropractor? Why see a wellness chiropractor during your pregnancy? I'm sure a lot of you have had the experience, and a lot of you will probably say low back pain. I'm honestly going to tell you that's probably the main reason why a lot of patients were referred to us maybe 20, 25 years ago. That is not the main reason why patients are coming to us now. So my practice is very diverse. We get all types of patients coming in, but our pregnancy patients, first-time moms, are coming in because of stress. Stress is the #1 reason. They are calling us because the stress is really affecting not their life, but their pregnancy, and they want to do something about it. So we all know we've lived in a different world in the past 2 years, and nobody wants to turn on the news anymore. But during the past couple of years, this has changed your bodies and it's changed your lives. And we don't want our soon-to-be moms to be bombarded anymore by things that can affect baby in the future. So we talk about stress in a couple of different ways in our practice. We want to know that stress can be physical, chemical, or emotional. The emotional strain that it's already had on us because of our lifestyle has been one area that we've been living with. But the physical stress on our bodies is a lot different. So when we talk about physical stress in my clinic, we talk about changes that are happening to our bodies. So obviously the main thing that you will see is your growing baby in your abdominal area. And as you have been gaining weight in this area, it's slowly shifting your center of gravity. And you've probably started feeling it right now. And this is probably putting a little bit more stress on the joints in your lower back. It might be tipping your pelvis forward a little bit. So it is changing your entire spinal curve. So as a chiropractor, I look for these changes in my patients when they walk in, but that's not the only physical stressors, right? Most of our pregnant moms-to-be that come in will also admit that they're now sleeping differently. So sleep habits, whether you're sleeping always on one side, you used to be a stomach sleeper and now you can't, and now you're trying to accommodate your growing belly and you're tossing and turning. That's another issue. We find that, again, during pregnancy, we're sitting differently. So we don't sit the same way, especially we can't sit on the couch because you know what, then we don't have any support for our backs and it's harder to get up. We are probably sitting at a desk and still trying to work at our computers and accommodate a growing belly in front of us, trying to keep our arms at 90 degrees and type on an external keyboard, but not really sure if you're in the right position and maybe putting a little bit more strain on your back and slouching. These are the types of physical stressors that we're talking about. But I want to go back, I want to go forward and just talk about, one other thing that I want to mention is that when you see a chiropractor that treats pregnant patients, you're probably going to ask, how is this going to work? And how do chiropractors treat me with a belly in front of me, and how is that going to be comfortable? Just like Jessica mentioned earlier, if you ask majority of the of doctors that you go see, majority will tell you that they use a technique called the Webster technique. So the Webster technique is a specific chiropractic analysis and an adjustment, and it aims to really reduce any type of interference to the nervous system and balance the maternal pelvic muscles and ligaments. So why is this important? Because then it's going to decrease any type of uterine constraints so that it allows your fetus and growing baby to position themselves better and prepare for birth. And that's exactly what we want. So Webster, you might have heard of, and you might think that it's only for breech pregnancies. It's not. Webster technique is used, and it can be used on someone that is not pregnant also. So I do use it sometimes for other patients, but it's specifically a great technique to use on pregnancy, and it works beautifully. And if you go to the next slide, I'm going to show you what this would actually look like. Going one more. I wanted you to see. So when you are receiving a chiropractic treatment, you're probably going to wonder, how am I going to be lying on my stomach? So we have specific tables that work wonderfully for a mom to be, because what you can't tell there, that table actually opens up in the middle, and it allows for mom's growing belly, because I actually can raise it, allow a lot of space for the abdominal area. And then we use a pregnancy cushion underneath to really support you. So there's no strain at all. And I can go around the table and do my work. So normally it takes no more than a few minutes, and mom is very comfortable. And once the treatment is done, she can either sit up or turn around, lie on her back, and I can continue on. So moms are, really coming in because they know that, again, with chiropractic care, we do know that you're able to carry and deliver your babies easier. We remove and release a lot of stress on your lower backs, but it's also shown in a lot of studies that it actually decreases labor time in women who've been receiving chiropractic care throughout their pregnancy. They've also found in some hospital studies that chiropractic adjustments during pregnancy have definitely decreased the need for even painkillers. So another reason why some of our patients continue with their care throughout their pregnancy. So let's talk about some of the chemical stressors that also have affected our moms-to-be's. So we usually start this during prenatal visits, and I definitely go over things like not just drugs and alcohol that could be affecting your health, but also what are some of the other chemicals that you can actually now start reducing in your diet, specifically artificial sweeteners, sugar. We all know that. Caffeine to a certain point is okay, but then you should also, make sure that you start weaning yourself maybe off and go only once a day. We talk about how a high carbohydrate diet should be changed to allow a lot more protein in your diet. So we try to get off all the white stuff and the beige stuff, and we try to change from white rice and white sugar and white potatoes, and honestly just try to incorporate more complex carbohydrates. So why do I talk about this and really classify it as a chemical stressor? Because for a lot of people, the carbohydrates and all the gluten does cause inflammatory changes in your gut, and that could also affect the rest of your body, even affect inflammation in other areas in your joints and your lower back, and cause those aches and pains that you're constantly getting. So prenatally, I talk to my patients about increasing their water intake. So drinking a lot more water, having a rainbow diet, making sure you get all the colors in the rainbow in your fruits and vegetables. So we do start with prenatal care and talk about our diet. And when I was starting off, I was talking to you about the emotional stressors, I guess. And, we know as moms that sometimes we don't know what to prepare for. And our lifestyle right now has changed so much. I just wanted to mention that one of the things that I've noticed personally in our practice is that my pregnant patients, you guys are great. You're coming in for care, but our lifestyles have changed so much that I find that most of my pregnant moms are working until the very last possible day. It used to be that, a lot of moms took off from work maybe a month or two prior to baby's due date. But because we work at home, a lot of people are opting to stay and be able to work and just, wait to the last possible moment. That just, again, affects your emotional stress, not knowing, if you have enough time to prepare. We also know that a lot of families have decided that mom will go back to work within, like 5-6 months instead of taking the full year off. Again, not making it easy for her, but thinking that since she's working from home, she might as well, take care of baby and work at the same time. We've noticed that a lot of our families now don't have the support of close family members like moms and aunts and sisters or sister-in-laws or doulas, and they're really opting to do this alone. So I find that all of that has created so much more emotional stress with my patients that that leading up to their labor and delivery, they are in now what we call sympathetic overdrive. Their nervous system is so highly in a sympathetic state, there is no time for rest and relax or the rest and digest state. So as a chiropractor, this is where I come in. My treatments are really aimed at balancing your nervous system, making sure that the body also goes into the parasympathetic state so the body can rest, the body can heal. That's what I talk about when I talk about emotional stressors. We've also been treating a lot of our patients past their labor dates, and they now come in with their newborns, and they're dealing with postnatal issues, of course. So one of the biggest postnatal issues I also wanted to bring up was breastfeeding. And again, breastfeeding for a chiropractor means that mom is always going to be in the same position all the time, holding baby the same way and causing some changes in her upper back. So again, our job is really to help and support our moms and teach them new techniques. So things like using a back support, getting a pillow to support baby also, and teaching her how to hold the baby properly on both sides. But sometimes it's not an issue with just mom. So we also look at the baby. And sometimes babies actually have an issue and a problem turning their heads to one side. So sometimes a baby can be born with something called torticollis. So that is when they can't turn their head one way and will often just feed on one side. So babies are also given gentle adjustments, and that usually resolves that issue quickly. We, again, as health professionals, also want to look at postpartum issues. And for me, I look at 3 different triggers with my patients. I look at sleep issues, again, nutrition issues, and are they alone, and are they not being supported? So we kind of point these things out and make sure that, again, mom has the help. She's got a doula, she's got family members, maybe someone that helps, or she signs up for a food delivery program to make sure that she does have time to just quickly prep a meal. And sleep issues are a tough one, but again, we just try to promote the fact that when you sleep, your body is healing. So right after labor and delivery, we want our bodies to heal. So sleep is another big trigger. We've also known that, again, our goal as family wellness chiropractors is really just to provide a lot of resources and health and wellness info for mom and the entire family. So we encourage different treatments for our families, but for mom, really the chiropractic care to balance her nervous system, take away the aches and pains, of course, better nutrition. We try to instill always a walking program. So a lot of my patients, if they're not active, then you know what, we start with 10 minutes a day. And our goal is to get to almost 40 to 45 minutes a day. Walking is the easiest way for you to just maintain mobility and flexibility in the lower muscles, and also, again, some cardio. I do encourage yoga for flexibility, and for breath work. So meditation and breath work is very important. And we've also taught meditation classes, but right now there's so many great apps that moms are encouraged to really take. If it all you have is 5 minutes, learning to just do breath work helps your body. Why? Because it will come out of that sympathetic state and try to get into that parasympathetic and rest and relax state. We will definitely be there to support home care after your treatment. So this means giving you ideas about how to avoid some other physical stressors, like the one-sided positions that you would always be doing something in, like holding a toddler, repetitive movements that you would constantly do to also aggravate and affect your body. Not to carry older siblings, and especially not to carry them over one hip. That's not going to be good for you, and that's definitely not going to be good for the growing child's pelvis. We will encourage exercises like sitting techniques, as in like rocking the pelvis, and how you can rock the pelvis while you're sitting so you don't fall into a slouch mode. And if you don't have a back support, it's okay, but you just learn that 1 inch of just rocking the pelvis will help keep your pelvic mobility. There's also exercises like our figure 8 exercises, where we give patients they just learn how to do this figure 8 move with your hips. And it's great during labor. It just helps a lot. And after labor, it's important just to keep the SI joints mobile. And we also will teach some techniques like massaging your round ligaments, which is a ligament that's attached from your uterus to your pubic bone. And this is the sharp pains that you would get in your lower abdominal area sometimes. So moms are taught how to massage this ligament even before getting up out of bed. Great idea to do that every morning. And it just helps just release that extra stress on your lower abdominal area. So I hope you kind of understand that I'm not just the chiropractor that just treats patients for pain. As you go through my slides a little bit more, a lot of my patients, like I said, are just coming in just for wellness and making sure that they maintain the ability to keep mobile and keep strong and be able to enjoy their pregnancies. And if you have any questions or any specific things you'd like to ask me, please feel free. I know that they have my email address somewhere and you can let me know, but I hope you've enjoyed a little bit of what I do, and I'll pass it over to you guys, Jessica.
Thank you, Dr. Sylvia. Thank you for sharing so much about the many things that you offer. I think a lot of people, when they think of chiropractic, don't know that it has so much more to do with the lifestyle as well. So thank you. We will have time for questions as well, getting into that. But first, just want to share some really exciting seminars we have coming up. We have a newborn sleep crash course. Let me try that one again. That's happening this Monday at 7. It's $40 a screen, and proceeds are going to Flora's Walk, which is a perinatal mental health fundraiser. And what it is, it's led by our child and infant sleep expert who walks you through what to expect. So all those things that Amanda was talking about, with that babies have wake cycles, but they're not awake a lot. That changes a lot from the first 2 weeks to 3 months. And it can be really helpful to know what those milestones look like and how to set yourself up for success. Let us know if you'd like more information about that. And then we also have a free seminar coming up. It's the first Saturday in May for anyone that's located in Markham. It's at Push Studio, which is a brand new wellness center in Markham. This will be a session both for in-person as well as virtual, and focusing on movement for birth, as well as how to prepare specifically for Markham Stouffville Hospital, if that's somewhere that you're located. But there's lots of takeaways of how to advocate for yourself, what are different options you can ask for, and this can be a really fantastic seminar to check out. So feel free to let us know if you have any questions about that too. So now, any questions? So I know some of us don't really want to unmic necessarily, so if you'd like to put them in the chat with any questions you have on any of the topics that we had tonight, including questions for Dr. Sylvia, questions for Amanda, questions for Heidi, or any general questions, let us know. And while I'm waiting to see if any questions come in, just to share, we will start our breakout rooms shortly. And this is a really great way, like I said, to get to know more about the Faces of Helping Hands for the people that are in your area. So I'm not seeing, oh yeah, perfect.
Hi, I'm Cheshta. Thank you for the great presentation. It was really informative. My husband and I really enjoyed it. I have a question. I'm a chiropractor myself, so it was really nice to hear Dr. Sylvia's take. I'm only in practice for 5 years, so I appreciate her experience. In terms of adjustments, now I am interested in having my colleague adjust me, but that would be like side lying adjustments, and I've heard that that can sometimes stimulate contractions. So I just wanted to know if she ever does side lying adjustments, and up to how many weeks is it safe to do so? Because I hear mixed things, but I think she has more experience with postpartum or pregnant women. So I'd love to hear her take on that.
Sure. I'm sorry, what was your name? I can't even see because I don't have my glasses on.
Sorry, it's hard. Cheshta.
Hi, Cheshta.
Hi.
It totally depends. So if I am specifically just doing a Webster technique and in the 3rd trimester, specifically because we might think that mom is either in breech position, you would not do side lying. If it's someone that I'm comfortable with and I've known, I know her body well, and it might be her 2nd trimester or her 1st trimester, and she does have specific low back issues, either related to, an old disc issue or an SI joint, a chronic SI joint issue, I might do it. But again, you don't use the same technique. You would use something like without any torque. So it's a very, and this is getting, sorry, a little bit more specific to chiropractic, but it is a very gentle side lying position with no torque. So you just have to make sure you put the patient just in side lying with just a lower angle in your elbow. And it's usually okay. So even Dr. Larry Webster, who came up with the technique, had said to Dr. Genio that you can't do side lying if for some reason the patient can't lie face down because you don't have that type of table. So I know that they actually did say that they use side lying also.
Okay, good to know. Yeah, I'm definitely feeling it in my SI joint, but I'm in my 3rd trimester now, so I'm craving an adjustment. Yeah, so thanks for that.
You're welcome.
Thank you for that question. Any other burning questions before we move into breakout rooms? Last call. Okay, let's get started. So this segment is not recorded. This is where you can ask all of your private questions to doulas in your areas. So let's get that started. You will see something pop up on your screen that's going to invite you to a room. Feel free to join in. We will be switching out to different team members in about 5 or 6 minutes time, which is really great because you get to meet most of us. All right, here we go.